Welcome to Pharm Mini number 12, where we'll talk about immunosuppressant and immunostimulant medications. An immunosuppressant's purpose is to suppress the body's immune response. So we would use this in different disorders where the body has a hypersensitivity reaction to any invading substances or to self. So we would use this for autoimmune disorders, organ transplant, acute respiratory distress syndrome, and any severe inflammation that occurs outside of what's beneficial for the body to fight infection. Overall, when we look at immunosuppressants, some general side effects that we can see is things like acne, diabetes, fatigue, hair loss, which would be like alopecia, or hair growth, like hirsutism, headaches, high blood pressure, sores that develop in the mucous membranes, especially in the mouth, osteoporosis, weight gain, nausea and vomiting, tremors, and increased risk of infection. The different categories of immunosuppressant medications include corticosteroids, also called glucocorticoids, calcineurin inhibitors, antiproliferative agents, mTOR inhibitors, antimetabolics, and antineoplastic medications. When we look at corticosteroids, this includes medications such as cortisone, prednisone, and methylprednisolone. So they typically end in ISONE or ONE. Corticosteroids can be administered orally through the IV, topically, in ear or eye drops, or through intramuscular injections. Basically, the way that a corticosteroid works to reduce an inflammatory response is it mimics the action of cortisol. Cortisol can limit immune activity, and in turn, it can reduce inflammation. The indications for corticosteroids specifically would be rheumatoid arthritis, lupus, infections, and skin inflammation. Side effects include increased appetite, weight gain, mood changes, muscle pain and weakness, hirsutism, which is that excessive hair growth in areas we wouldn't typically see hair growth, bruising, blurred vision, swelling, acne, increased blood sugars, hypertension, nausea and vomiting, restlessness and anxiety, vision changes, and insomnia. For our nursing considerations, we would want to be aware that since a corticosteroid, and this is the case really for all of our immunosuppressants, since their goal is to reduce the immune response, they're always going to be at risk for other infections. Also for corticosteroids, it can cause hyperglycemia and poor glucose control. Education would be for the patient to monitor bone density as well as blood sugar, especially if they have any form of diabetes. Then we have our antimetabolics. Examples of this would be like fluorouracil, methotrexate, and hydroxyurea. This can be given orally, IM, IV, or intrathecal. And the way that an antimetabolic works is it interrupts the S phase of cell production to limit growth of fast-growing cells. And there's two types of cells in our body that are typically identified as fast-growing. The first one is immune cells, and the second one is cancer cells. So as far as indications go for antimetabolics, we can give this for cancer as a form of chemotherapy, and we can also give it for autoimmune disorders. Side effects of antimetabolics include nausea and vomiting, loss of appetite, headaches, weakness and sore muscles, elevated liver enzymes, hair loss, dry skin, diarrhea and constipation, low white blood cells, and vision changes. Nursing considerations are to monitor liver enzymes and CBC levels, know that they interact with certain growth factors, and we'd want to provide education to our patients on how to manage the side effects and also give them resources for side effects. So for example, if they have a lot of hair loss, how can we refer them to somewhere that might provide them with a wig or hair growth opportunities? Then we have our antineoplastics. This is another form of chemotherapy. And examples of this is there's multiple different classes of it. So there's alkylating agents, which end in either amide or platin. And the most common that we'll see is cisplatin. We can provide monoclonal antibodies, which end in MAB, antifolates, which end in trexate, histone decatylase inhibitors, which end in inostat, monoclonal antibodies, which end in zumab, protein kinase inhibitors, which end in mib, nib, or isib, taxanes, which end in taxol, topoisomerase inhibitors, or hormone agents, such as androgens, estrogens, and medications that also end in amide, oxyfen, relin, and rectotide. The most common hormone agent that we'll see is tamoxifen, and that's used to treat breast cancer. So antineoplastics can be in liquid form, pill form, or given IV. And the mechanism of action really depends on the type, but the main purpose of an antineoplastic is to stop cell growth of fast-growing cells like the cancer or immune cells by interfering with different phases of cell reproduction. The indication for antineoplastics is cancer, autoimmune disorders, and any improper functioning of the immune system. Because the purpose of this medication is to stop the growth of cells, it does cause cell death. While we try to make it as specific to the cells that we want to kill as possible, that's not always what happens. So this can actually cause cell damage to any cell in our body. So symptoms can occur anywhere and in any form, depending on what cells are destroyed. So it can cause damage to the lungs, the liver, the kidneys, reproductive organs, and any bone marrow. It often causes hair loss, nausea, and vomiting, and it can significantly increase the patient's risk for infection. So nursing considerations is it should not be given with pregnancy, and if someone is trying to conceive, they should avoid taking these medications for at least 6 months prior. It does require special handling and administration, so the nurse would have to wear gloves, goggles, gown, and a mask, and it needs to be disposed of in biohazard containers. We would need to monitor the patient's liver enzymes and educate them on infection prevention because they'll often be on neutropenic precautions. So neutropenic precautions is the one type of precautions that we use in the hospital that aims to protect the patient instead of just the nurse. With these precautions, they have to have a sterile environment. They wouldn't be able to have things like pets in the room, any live flowers, things like that. They should avoid eating any raw fruits or vegetables or undercooked meats. They should avoid large crowds and ultimately implement infection prevention techniques like hand hygiene. Then we have our immunostimulants. So immunostimulants are drugs that aim to enhance the immune system. So they can work on any part of the immune system that may be deficient. The indication would be to have infection, to have autoimmune disorders that cause deficiencies in the immune system, for patients that have inflammation, allergies, or compromised immunity. Examples of immunostimulant medications would be things like vaccines, colony-stimulating factors, interferons, interleukins, immunoglobulins, vitamins and minerals, and growth hormones. And that wraps up our discussion on immunosuppressants and immunostimulant medications.